Hey, sports parents, if we haven't met, my name is Jonathan Carone, and I'm the host of the show. Today, we're talking with Dr. Jeffrey Shilt. Dr. Shilt is the community in chief at Texas Children's Hospital and a professor of orthopedic surgery at Baylor College of Medicine in the Department of Orthopedics. He is currently the medical director of the Motion Analysis and Human Performance Lab and serves as the pediatric sports medicine liaison to the United States Olympic and Paralympic Committee and is the chairman of the medical advisory board for USA Cycling. Needless to say, when we talk about bodies of kids growing up, he's the person we need to talk to. In our conversation, we talk about the importance of helping our kids find intrinsic motivation in sports before turning to the nuts and bolts of growing bodies and how to support our kids as they develop. And here's the thing. Today's episode is not just about physical development. We talk about the psychosocial development a lot as well. So it's a well-rounded conversation about all aspects of your kids growing up. Before we get to that conversation, though, if you like the show today, we're going to ask that you rate us and review us wherever you're listening. If you're listening to Apple Podcasts, writing up a small review would be a huge help. If you're watching on YouTube, make sure to hit that like and subscribe button. Most of all, if this episode helps you in any way, the best thing you can do is share it with a friend. Now, with all that out of the way, here's my conversation with Dr. Jeffrey Shilt. We're here with Dr. Shilt. Thanks for being here with us today. We appreciate it.
Thanks, Jonathan. I really appreciate the opportunity to chat, and thanks for having me on.
We were talking just a minute ago before I hit record about your kids, and I wanted to get it on here because this is my favorite part of the show. We're going to talk about the doctor stuff. We're going to meet the doctor in a minute, but I want to meet Dad. So can you tell us a little bit about your kids, what they play, and what it's like being dad to them?
Yeah, you bet. So part of the story I didn't tell you is I'm blessed to have sort of a blended family. I have a 31 and a 29-year-old daughters, and then 11-year-old twin boys. And it was interesting to see this process twice through. So the girls, I saw them as young women, and my wife is far more athletically talented than I am. And they had all of her athletic talent. They were super fast, really skilled athletes. And it's been funny, though, that their interest in sports was very low. So I'd always have to bribe them to get them to go out and do anything. And so really funny to watch them grow up. And then I've had a second chance at it with my twin boys who are 11, and seeing how their approach is different. Even though they're twins, their approach to sports and athletics is wildly different. So it's been fun to watch that and see how they all develop and how each kid enters the sports together. My boys are on an interesting journey in that we live in Texas, and they're Texans, but they ski for the Park City ski team. And they've been doing that now for a number of years. So they go out in December and then stay there till April, working with the ski team there. And it's been a fascinating journey to watch them do something that they've been attracted to since they started skiing before they were 2 years old. And to see them sort of develop in that particular area has been really exciting and fun. So yeah, that's my kids, and yeah, it's been quite a journey to watch them ski, and they play every sport, so it's been kind of fun.
So I got to ask, what would the older girls say is the biggest difference from their version of dad coming through playing sports to the boys' version of, because there's a 15-year gap there. Like, yeah, how is dad different now than then?
Yeah, it's a great question. I think what I saw, I grew up and I love sports, and that's just where my head was focused 24/7, 365. And I was one of those kids that did okay because I just worked really hard, but probably lacked, the talent that a lot of, great athletes have. And I saw the girls who have all this innate athletic talent, and I was just like, it just drove me crazy that they weren't more interested in sort of driving into that. And so I would try to figure out every way possible to get their interest levels higher. And I think what I learned, and what they would probably tell you, is that it's a little different with the boys. As I said, the boys, I'd say if you looked at them athletically, they both have about the same degree of talent. One's super interested and focused on it 24/7, 365, and the other one isn't. And I think that would be the difference. Is now I've learn that you can't force kids to do anything. What you really got to do is give them opportunities, listen to what they're interested in, and help them find that area that just really is really special to them. Because that's really and I'm sure we'll talk about it at some point, but it's the one thing you can't really instill in kids is passion, and passion is what drives the development of any sort of skill set or talent, and I think that's what I've learned is keeping it fun, trying to find specifically what keeps kids interested in. I think the one thing that I probably haven't changed though is how important I think it is to remain or create and then maintain a healthy lifestyle. So even though it's not something we necessarily, the boy that is a little less interested in some sports, what I've said is like, this is just the way we live. This is what we do. Creating a healthy and participating in a healthy lifestyle is just part of who we are. So that part is non-negotiable. But how we get there is you got to be passionate and have fun. So that's probably the difference, I would say. I probably didn't have quite that degree and level of understanding, 15, 20 years ago that I do now.
We tell our kids, like, we don't care what they play. They can choose what they play. But right now, like, every season you're doing some activity, some physical activity. Like we're not going to, like, my kids are 8 and 11 or 8 and 10, excuse me. And so we're in 3rd and 5th grade right now. We're not going to go super crazy travel and stuff, but they're going to be playing one physical activity, whether that, like right now it's soccer and dance, and my son's going to play basketball this winter. If they wanted to do karate or some other, like if they wanted to run, I don't care what the thing is. Activity is going to be a part of your life, because looking back, I look at my life where I played all the sports growing up, and then after middle school, I stopped playing everything, and physical activity stopped being a part of my life from about 15 to my mid 20s. And I probably put on 100 pounds, and I'm still trying to get that off today. And it's like, I enjoy being active again. And so I just don't want my kids to go through what I went through. And like you said, I want activity to be a part of their everyday life.
That's precisely how we do it too. I mean, they do have this consistency with the ski program and so forth. That is the one thing that they choose to do consistently from year to year. But much like yourself, we say you got to play a sport every season, and we don't care what sport it is. And they have done everything from fencing to parkour to, you name it. And, tackle football. I mean, we've literally hit the entire spectrum. And again, we're much like yourself. We say we don't care what it is, but you got to do something. And it's again, the other interesting thing is we starting off. Probably it's been maybe 2 years ago now. Had this idea in my head that we start off every day with push-ups, and when the boys started, they were like probably like 9 or something, and they couldn't do a push-up to save their life. And so I went at it, with this approach that we were going to try to do 30 every morning. And what I told them is that we would do it in groups of, 5 or 10 at a time, whatever they could do, and that I would do it with each of them. And so we'd get up in the morning and do that. And the first thing that I saw was, of course, their technique was horrible. But then I realized in my mind, I wanted just to establish a little, I think what you're saying is I wanted to establish the pattern. I didn't care about how skilled they were at it. I just wanted them to establish the pattern. And so I didn't even say anything about how they were doing them. I just, if their head was bobbing up and down, I counted it. I was like, it's just really about
They're 9.
Yeah, it was. I was like, you know what? If their technique isn't good, if it's not, that's okay. And so we got through it, and I set it up, and I said, if you guys do this every day for the first 30 days, I'll give you. I said, I'll pay you $20, or I think I let them, choose, and they said $20. I was like, wow, I got off easy, and it was such a celebration. Like my wife, Erin, we all came in on that 30th day. We all walked in. We all did our 30 push-ups. They got their $20. And the greatest thing about it is it established this pattern. And so if they'll ask for something, sometimes I'll get this they have screen time limits and all that sort of stuff, and I'll get this little screen time if I don't see him in the morning before work. He'll say, hey, and I'm like, hey, have you hit your push-ups today? And it's, yes. All right. I'm like, we started our day right. So it is
So
about
over the summer, my kids are home a lot of the time. They're at some different camps or whatever, but we bought these little soccer ball trainers where it's basically a soccer ball in a net on a string and you can just kick it. And I told him, I was like, hey, we'll give you, for every 15 minutes you kick the soccer ball, we'll give you 15 minutes of extra screen time. And then we expanded to 15 minutes of any activity, we'll give you extra. The first day, my daughter, who's never wanted to practice outside of practice in her life, I hear her in her room, click, kick, kick, kick. And it's like, it was a way to get them moving a little bit and get them like, they're just kicking a ball because we had practice starting out. The week this comes out, I think, is the week that we're starting practice. It's a way for them to get some time in their sport without it feeling like training, without it feeling like something hard. And it also reinforces like screens aren't necessarily bad, but sitting all day is. So we have to do some type of physical activity if your reward is the screen, whatever. So that was just like you're saying, a little fun thing that we added in that seems to be doing really well with our kids right now, at least.
Yeah, and it's fascinating how you can play with that. So we got to the place where we're doing 30, and then I was like, all right, 30, and I was like, now their technique needs to be a little better, and I'm like, well, how do I get that in there? And so I just made up this term. I'm like, well, you have to do 30 push-ups, and at the end you do 5 nose push-ups. And they're like, well, what does that mean? And I'm like, well, you just have to put your nose to the floor. And it was like, oh, okay. They don't. They're just like, sure, Dad, whatever. And what it did is it created like this opportunity for them to do more of a full range push-up. And over time, it goes back to these principles of what's important to keep kids engaged and involved. It's like you just keep it fun. And as long as you can keep it fun and they're not burned out or depressed by it or anything like that, the longer they're in it and the deeper you establish these patterns, the better off it becomes. And then they make the decision to become more skilled at it. And so anyway,
their competitive nature kicks in eventually.
Absolutely, and they see each other, and then they start critiquing. I don't do anything. They critique each other. It's like, well, that wasn't a real push-up, and they've over time, and so it's really that combination. It's like establish the pattern, kind of sneak in a little bit of skill training without them realizing it, technique training, and then let them sort of, and they'll catch each other, it's like, hey, I don't think that was a real push-up. You really didn't get your nose all the way to the ground on that particular one or whatever. But
if it was Dad saying that from the get-go, they would have quit a year ago.
Absolutely. So now they sort of self-govern and now it's all blossomed into other areas where they'll set up challenges for each other now that are kind of related, to the same thing about some sort of body, functional strength training or something like that, and it's been really fun to watch them, push each other or develop something else. And they'll ask me, hey, can you do this? And, you can imagine like stiff old Dad trying to do some of the, more, technically demanding things from like tumbling or something like that. But I do it, I'm like, all right, I asked them to do this, so I got to try it, So it's been fun.
All right. We could talk this side of it forever, but if I have a world-class doctor in here, I'm going to ask questions for a world-class doctor. So here we go. Today's episode is all about helping our kids as they grow into their bodies. And it's interesting because you're right there in that with your kids as well. Before we get into more of it, can you help us understand what's happening in a kid's body during these key growth years, especially when they're active in sports? And then I think as you get at, what age range are we talking about here when we have this conversation?
Yeah, well, that's a great question. And, I've talked about in the past, like what differentiates adult athletes from, pediatric or adolescent athletes. And what you really think about is a couple key different areas. One of them is just musculoskeletal maturation. Another key area is hormonal maturation. And the final one is really their psychosocial development. And those are the 3 critical areas that separate young growing athletes versus adult athletes. And so, and each period of time is different when you look at those. And so, your hormones are changing, and as you get older, obviously, your psychosocial development is changing, that whole time. And then again, your growth plates, your musculoskeletal development is changing across the way. And so I think, one key area I think about is around age 11 or 12. And this is where kids begin to develop this idea, they're not so fixated on permanence. And they can start to see things being more fluid and dynamic. So in other words, you take a kid who is 5 or 6, and they find, they try something, and in their mind they're just not good at it. Or they're really good at it, but it's either black or white. Like, there's no difference. So you're either good or not good at it, and they don't understand that you could practice at something, and if you're not good at it, become good at it. And that change starts around 12, where they can start to see that it's not as just ingrained one way or the other, that there is some opportunity to be different than where they are today. And so that's a big one for me is that age of 12. Every kid develops hormonally a little different. And so we think about what things are you trying to train in your kids in different sports. And really, a lot of strength training it's fine to do some of it. I think strength training in young kids is fine, but you got to be really careful because they're just not going to see the gains. So the focus on that at before puberty is just it's not really all that valuable. So and those younger kids under that period of age are really thinking about just skill acquisition, keeping it fun, working on maintaining, if they do have functional deficits in their strength or in their mobility or anything like that. That's where we kind of focus on that. And then as they progress through puberty, obviously you start adding on the things that are inherently benefited by those hormonal maturation periods. So that's kind of the difference between those two groups for me.
I am the epitome of what you're talking about, those things happening at different times, because so I have an October birthday, middle of October. I started school when I was 4 years old because I was already tall enough, and I had the academic, I was more mature kind of. So my parents said, let's go ahead and start him. I was the tall kid all throughout elementary school and high school. I have pictures of me sitting in middle school next to somebody where I'm like full head and shoulders taller than them. But then I stopped growing at like 13 or 14. So growing up, I was the kid that grew so fast that my muscles and tendons didn't really keep up well, and I sprained every lower ligament I could. And looking back as an adult, that psychosocial you're talking about, being a year younger than kids in my grade, there were some pieces that, that's why that happened. They were a year more mature than I was, even though my body was there, even though my academics were there. That psychosocial piece was just a little behind that I didn't quite understand until I got older.
Yeah, that's absolutely true. And we see that. That's, it's been well reported that depending on where your birthday is and where you are in that sort of maturation, kids who have January birthdays, for instance, we know that they tend to be a little bit more advanced than the kids who have December birthdays of the same year, right? And so at younger ages, that year could be big. It could be really, really massive. And then you take in that other part where, late bloomers and early bloomers and so forth, and you layer that in and so forth. And so there can be a huge impact of how quickly and where you are in the maturation phase on your athletic or physical development. And that's a tough one. I think, I think it takes a real skilled coach or parents or, teachers, what have you, to really be able to appreciate that and then modify where you are devoting that training or coaching or whatever to each of those kids, because they're all different, and you see it, you see that spectrum where, I think about a couple of the kids' teams now, and there's that kid that literally they come up to their armpit, and the other kid's, a foot and a half taller than them, and, is already, looks like a teenager,
Hmm.
and how different that is. And you can just imagine it's both physical and psychosocial, right? Psychosocially, this kid's like, well, I'm just not that good. It's like, no, you just haven't hit that growth phase or that maturation phase to really appreciate that. So big impact on that for sure.
So one of the things we hear a lot about right now in the youth sports space is overtraining, overplaying, overuse injuries. So as someone who's in the field, and we're talking about this, let's say 10 to 15-year-old range right now where they're growing into their adult bodies, what are the common issues or injuries you're seeing in that age of athlete? And is it overuse that's causing it, or is it something else?
No, it's a great question. I think it's like many things. It's multifactorial, and what we'll see is there is an element of overuse, and it can be that you're just doing too much of whatever that specific sport is. Whether it's a throwing athlete and they're just throwing too much. It could be running too much. It can be any repetitive sport that you're doing, and the impact of that particular sport on the growth, where the tendons attach to the bones or where the growth plates themselves are. It can be really there can be a huge impact. And so I think it's really balancing it. What we've really done is, and it's there's no cookie cutter way to apply it. It's not at a certain age that all kids are a certain way. It really is specific. And what we've been sort of focusing on is this idea that we'd like to do a functional assessment on kids. And you see somebody and you're like, oh well, they have whatever limited mobility or limited flexibility, and you think, well, that happens when you get older. But when we screen kids, we see it happening in kids that are really quite young, and again, very disparate from kid to kid. And so I think what we try to do or think about is to look at each kid and evaluate them in a functional way that can assess their strength and mobility, and then create a pathway or plan for them to address areas where they have opportunity. And so every kid, throwing the same number of pitches isn't going to have the same response, because maybe they have limited mobility or they're using certain muscle groups to overpower areas that are weaker, and then that predisposes them to an overuse injury. So it's this really multifactorial number of events that are contributing to this overuse. And then some of it is just no break from a specific sport or a specific action. I mean, you got to have time to recover, and again, that changes from athlete to athlete. So it is multifactorial.
The piece that resonates with me, you were talking about how different parts of your body will overcompensate. And one of the things that I've dealt with over the past year or so I've dropped 65 pounds over the course of about 14 months. And about 30 pounds into that, I tweaked my knee. And so I play disc golf once a week. And with the disc golf motion, it's a rotation on the front leg. And I thought it was because I was playing more. I was playing like twice a week at that point. And I thought it was because I was twisting a ton and that was it. So I did what every good athlete does. I decided to rest it and give it a break. And so I stopped going to the gym for a little while, and I finally got in with the orthopedic and got the MRI. Nothing showed on the MRI. I'm probably 6 to 8 weeks in at this point, wondering why my knee's not getting any better. So I went to a physical therapist, and what she quickly diagnosed was that as I had lost the weight, my quad, the strength of my quad, had diminished a little bit. And so it was, I have some functioning in my posterior chain going from my lower back into my glute and so that wasn't working right. And for the longest time, where I was so overweight, my legs were so strong that my quads and hamstrings were compensating for it. I lost the weight, so the next thing to go was my knee. And so I've been around sports my entire life. I thought I twisted my knee, and I'm sure that I've got a torn MCL, when in reality it was my body was compensating in a way that I just didn't know.
Yeah. Yeah, we see that, and I think your response is, it's the old sort of treatment for everything was RICE, rest,
Yep.
ice, compression, elevation, and the reality of it is what I started realizing a number of years ago. I was with a training group in Boulder, Colorado, doing a bunch of endurance training at the time, and what I saw there was this group of Japanese marathoners that were training in Boulder. And it was this first idea of this concept that complete rest just creates deconditioning. It's probably not it's probably not a positive thing.
As
So
I rested, that quad strength, it was 3 months of no training. So the
yeah,
problem was getting worse.
it was getting worse, and you see that, and so what you try to do is reduce activity. I would say rather than rest it, the right idea is to reduce activity and then pinpoint the areas that may be predisposing you to the underlying injury you're trying to address, and that's really what we've really pivoted and started doing is instead of resting people, try to reduce their activity, reduce the stimulus that's causing the problem, and then address areas that might be predisposing that particular injury pattern to begin with. So really, it's pretty unusual now in my practice to tell people to rest. If you have an injury, what I'm going to do is probably get you into a program with a good physical therapist to identify, areas that you need to be working on, whether it's with strengthening or mobility, and then start focusing on that, reducing your activity but not resting, and then or not completely resting, and then build back up over time, addressing imbalances. You're talking about your quad versus your hamstring. Those, we know that there needs to be a really healthy balance between the quad and the hamstring. If your hamstrings are really weak, it overloads your quad and so forth. And so again, it's really that idea of not resting, but reducing activity, and then trying to figure out areas that you can that might be deficits in your strength or mobility, predisposing you to as a setup for one of those injuries.
I want to talk more about some of those misunderstandings in just a second. But before we do that, we're going to take a quick break to share some resources with you. And then we'll be back with Dr. Shilt on the other side in just a minute.
Have you ever showed up at the wrong field at the right time? Hey, my name's Zoe, and I've got 3 athletes on club and travel teams, and that's happened to me one too many times. So 2 years ago, I created a new app called Torgo, exclusively for sports parents. It imports schedules from all the different team apps, as well as your personal calendar to keep the entire family, including your kids, on the same page. Go to orgohq.com, download directly from the App Store or Google Play, and make Orgo part of your winning routine. Get the right people to the right places on time.
Hey, it's Jonathan. If you haven't signed up for the Weekend Playbook yet, here's the deal. Every Friday, I send a quick hit encouragement to help you head into the weekend with purpose. We talk about stuff like how to handle post-game silence, what to do when the ref blows a call, or how to meet your kid right where they are. The goal is simple: to help you show up better and be the parent your kid needs. The link's down in the show notes. Go sign up today. We're back with Dr. Shilt now, and one of the things we were just talking about is some of the misunderstandings that we have about just the body in general, based off of what may have been the best knowledge at the time as we grew up. And so now as we are adults, the research has shown us new things and we've learned new things. So in your experience, what are some of the biggest misunderstandings parents have about growing bodies in sports today that maybe the research has showed us a new way, or maybe we just learned something new that we didn't know before?
Sure. Yeah, I think we were touching on it previously. I think this idea of one size fits all is really inaccurate, and not all kids are flexible. Not at all. We do these functional screenings for kids, and we bring them in, and you think very basic things. You think, well, all kids can run, or all kids are can touch their toes, or you name it. Whatever you have out there is your preconception of kids being young and healthy and flexible and strong. But all those aren't necessarily true. And what we have seen is that kids can have really tight areas of their body, or they can have really weak areas of the body that create these imbalances. And if you don't address them, then sometimes they'll exhibit themselves as either an inability to perform a specific task, whether it's sports related or not, and then the kids start just avoiding it. And rather than sort of getting in there and addressing it and helping them figure out how to have functional movements that are the healthy way to do things, people just avoid it. And if they start avoiding it, then they set themselves up for a lifetime of moving improperly. And, these things, we see this in other parts of health too. We used to think that, heart disease only occurs in, 50-year-old, people with underlying genetic issues. But what the data is saying is you start to see the beginnings of coronary artery disease in, pre-adolescent kids. And it's the same thing I think about functional limitations, is that those probably have been existing since they were born or early age, and we just didn't identify it. And then everybody stops moving to avoid that particular area, and so that just progresses over through life, and either they just avoid the activity altogether, or they repeatedly put themselves in a position of risk. So I think that if I had to choose one thing that I think is a misconception is really that, everybody who's young is flexible and strong and, can do all kinds of activities normally, because I really don't think that's true. We see it every day when we critically evaluate these kids.
One of the things I learned through that physical therapy process was talking to my doctor. Growing up, running always hurt for me. And my shins and my calves, they would get like super rock solid tight. And even I remember I went to a Braves game one time. We had to park really far away, and I had to walk up a hill to get to the Braves game. And by the time I got up that hill, my calves were it was like a permanent cramp for like 10 minutes. And I asked Lauren, I remember asking, I was like, is that tied to this chain thing we've been working on? She's like, yeah, it is. So and she explained to me that with all the compensating muscles and how all that works. And I was like, so you're telling me this issue that I'm dealing with now as a 38-year-old man is the same issue that made it hurt to run as a 10, 11-year-old kid, which is why I quit playing soccer. She's like, probably. I can't tell you for sure, but there's a good chance that that's the exact same thing that was going on back then.
Absolutely. I think that story highlights exactly what I'm talking about. I think, things that, we're all in sort of a gradual musculoskeletal decline, in life. And but when you're younger, you have so much greater capacity or bandwidth before you really see it. And as we get older, obviously that bandwidth and that capacity decreases, so it really becomes prominent. But I think a lot of the things that we experience as adults are really there as kids, and we fail to identify it. And we fail to do anything about it. And I think, given time and effort and so forth, you'd be in a much better place as an adult if you were, focused on it as a younger person. So,
well, when we talk about the younger kids, and especially in this 11 to 15-year-old range, we've all heard the phrase growing pains. And we all know preteens and teenagers can be a bit whiny. That's just, we know that. But as parents, how do we know what's normal and what's not when a kid is complaining about something hurting? I think another way to ask it might be, how can we tell the difference between just whiny teenager and something actually going on?
Yeah, it's a great question. There's a few things that are always red flags that we consider to be red flags. And one of them is pain that wakes you up in the middle of the night. Now, growing pains tend to be growing pains that maybe you have a hard time getting ready to go to bed, prior to bedtime, in the evening, you might have some aching and so forth. But if you're waking up in the middle of the night because of pain, that's a red flag. You shouldn't, if you're sound asleep, you shouldn't wake up because of pain. And that's something that, we'd want to investigate, more closely. The other one I always think about is when sort of activities that they commonly do, they just start avoiding because they don't want to do them anymore, because the pain really prevents them from doing that. I'll see lots of kids that tell me, I hurt when I do this, or I hurt when I do that. And I'm like, well, do you still do it? And they're like, well, yeah. That's a little less worrisome to me. If you're continuing to be able to do the activities that you do on a daily basis, then I'm not as worried. So those are two big things. I mean, we could go down another whole other path of, losing weight and, you know, crazy stuff that can happen with, tumors or infections like fevers and chills and all that sort of stuff. But the two that I think come most commonly to me, I'm like, I need to investigate this further are, do I wake up in the middle of the night out of a deep sleep because I have pain? Or the other big one for me is if I stop doing activities that I tend to do every time and I really enjoy. That's the key, is like if they stop doing that, then there's something really wrong. But if it's, they do the activity, they continue to do the activity every day, and they jump down at the dinner table and they're like, my knee hurts or my heel hurts or what have you, then I'm like, well, are you still able to keep playing and doing? Oh yeah, absolutely. I don't want to stop. That gives me a little reassurance.
On that front, I'll give you a story. My 8-year-old, this past soccer season, I noticed he stopped running a ton during games, and we couldn't figure out what it was. Me and my wife actually noticed it the same game, and she noticed him limping off the field, and he kept pointing to a spot on the bottom of his foot that was hurting. And so we're like, maybe it's the cleats. Maybe he's like, even though he hasn't, there's still a little bit of space there. Maybe he just needs a new pair of cleats. So we went and got him a new pair of cleats, and it seemed to get better, but there were still times where his foot hurt him while running. He has terrible run form. I'll be the first to admit that. Like, again, he's 8 though. We're talking about earlier, just letting kids play before worrying about form. So, and he's also a bigger kid. He's like me. He's going to be the kid that grows faster, and just the way that he is. And I mentioned next week I'm talking to Farrell Frankel, who's a nutritionist, and in the interview I'll tell her it's like he's been in the grow wide before growing up phase for a little bit, because that's how kids grow. Yeah. And so how do we know the difference between something like his foot just hurts because he's growing and he's maybe a little too big for his bones right now, versus like, is it the shoes or is this an actual injury? Like, as a parent, like, I don't want to rush to the doctor every time my kid has a little bit of a hurt, but I also don't want to send him out on the soccer field if something's going wrong.
Yeah, I mean, I think you guys had a great intervention, which is, try simple things and changes. Change his shoes, and if that helped, then great. Reducing that activity a little bit, see if it goes away. I think the things that you worry about is if things are progressively getting worse with that reduced activity instead of getting better. That's something you need to be more worried about. If it just doesn't go away. I think that's a reasonable time to, if you've tried it and 3 to 5 days go by, you've reduced the activity a little bit, made some changes with whether it's equipment or shoe wear or what have you, and you don't see it reducing, or it starts getting worse, then I think those are the things that would prompt me to go in and have a deeper evaluation. But yeah, I mean, I think what you did is exactly right. Just change it up a little bit. Not necessarily completely rest and decondition, but change the activity up, reduce the intensity of the exercises, maybe change some shoe wear, see if there's if there's improvement there, and if there is, then great. If there's not, and it's persisting and doesn't go away or starts to get worse, then I think it's valuable to go ahead and get a more deep evaluation.
Just so parents can hear this, because I know my wife is this way, can you tell parents that you want us to come in when we have concerns and that we're not wasting your time if it ends up being nothing? Can we just have that clip of the doctor saying that?
Well, I have to remind my colleagues of that sometimes too. Sometimes they'll say, well, it's nothing. And I'm like, that's the greatest thing you can tell a parent is, is to tell them, I've looked, it doesn't mean something's not there, or I just can't uncover it today. But what I can tell you is I don't think it's anything serious, or it's nothing serious that's evident today. And so I can tell you when, as a surgeon and just starting off in practice, approaching 30 years ago, that would be the thing for me. I'm like, if it came into me, I would be like, is this surgical? If it's not surgical, then, I'm not your guy. But the reality is I learned over time is it's such a gift to be able to evaluate and see people and say, I don't know what's causing your symptoms today, but what I can tell you is it's nothing evident that's really bad. And I found out as a parent with the girls and now the boys, what a gift that is too, is that I might not have the answer for you today, but I'm really interested in following, and I'm also okay if you come back and see me again. Like, that's totally fine. just because I didn't see something today doesn't mean I won't see something next week. And what I want to make sure is there's nothing bad. If it ends up being, an overuse injury or tendonitis, that's the greatest thing in the world. What I don't want to miss is, a stress fracture or a bad infection or, God forbid, a tumor or something like that. So I always want parents to come see me. I think it's, like I said, I may not always have the answers, but it's comforting both to me and I hopefully to the parents to be able to say, it's nothing serious. I'm glad you came.
Yeah. I will be clipping that and showing it to my wife, who always worries that we're like, she's a nurse. So she's like, I don't want to waste their time. I'm like, you're not wasting time. Like if one of your patients called you and said, I have this, would you feel like it's a waste of time? Well, no. Okay, then, but you know how parents are. We get worried about that sometimes. Last question I have on this, and then we'll end with what we end with every week. We talked a little bit about physical habits and doing that as when we started the conversation, but in terms of communication with our kids, how would you suggest we talk to our kids about their bodies and about growing and injuries? Because I remember growing up, my parents didn't have very many resources other than to buy me a new pair of Husky clothes and give me some ibuprofen. So I have some issues that I got to work through. I'll talk about this more in next week's episode, but I've got some issues I had to work through and I'm still working through because of the conversations around my body growing up, because in the 90s, we just didn't have the tools that we have today. So when it comes to talking to our kids, do you have any advice for us on that?
Yeah, I think, validating their feelings is super important. It really is that whole idea of psychosocial development as kids are growing, how they see the world. Things that they may be feeling may not represent reality. And that's okay, but I think validating their feelings is important. And then also helping them see that where they are today isn't necessarily, if it's something they want to change, where they are in the future. We're all capable of doing things, differently. And when I think about today is, really focused on growing athletes, but I think it's for all of us anywhere we're in our life. And if you break it down to think about how do you achieve success, it's about being able to stay in the game for a long time. And how do you stay in the game for a long time? I like to think, I always think of life sort of in 10-year blocks, which is really hard for young people to think about. But if you're going to do something for 10 years, then you gotta have really maintain a positive mental health, perspective. A big part of that is avoiding burnout at any given part. So giving yourself the freedom to take brief, episodes away. The things that I found for me is just how critical it is to establish a healthy diet and then avoid injury, because those things are what keep you in the game, whatever that game is. It's going to be different for everybody. But if I can maintain a positive mental health and outlook on things, if I can make sure that I do my best to have a reasonable diet, and then I really just avoid risky activity and injury avoidance, that keeps me in the game, and I just have to keep showing up. And if you can keep showing up for a decade at a time, there are very few things that you're not going to become better at. And so that's really, it's kind of my own personal sort of mantra, but I've learned how to better, share that with other people, my kids most importantly, right? Is like, just you got to keep at it. And I think a big part of it is not, I think when I was younger, I might have not always validated their feelings, but I think, just validating people's feelings and then helping them see that wherever they are today is not necessarily where they're going to be in the future.
Yeah. I interviewed Ray Allen over the summer, and he told me, and I love this so much. He said, the most important word you can teach your kid is the word yet. You might not be there yet. You might not be good enough yet. You might not be on that team yet. But if you keep working at it and you stay in the game, in your words, then eventually, one of the things I tell people all the time, the data has showed us the same thing for the last 20, 30 years. Like 70% of kids quit by the time they're 13. And the number one reason they quit is because it's no longer fun. So if we can keep our kids having fun till 13 and they love their activity, whatever it is, so much that they're willing to work at it, then they're going to have a great chance at making that middle school, high school team, if that's the goal, simply by attrition. Because 70% of the kids are going to be done playing. And if you're willing to work hard, you might not get a starting spot in 7th grade. But as your body matures and as you learn that psychosocial that you're talking about of like working and you have that yet mindset, then you're going to get there eventually. But for 12-year-olds, it's hard to think that way.
That's super hard. I love that. That's a great quote from Ray Allen. But I think, for me, it's also kind of helping people figure out what their passion is, because it's really hard to teach passion. And so, you validate their feelings and then you help them figure out something they're going to be really excited about. And it's separating what they're excited about from what I'm excited about. Mm-hmm. Those aren't always the same, but just, as life goes on, I think we all reflect on, it's like, we've all, or I hope most of us have found a place something that we're really super passionate about. We've had some period of time where we get really excited about something and how wonderful that is. And it's not usually something that someone forced on you. Mm-hmm. Or it's something that you developed on your own. And I think that's been I think the area that I've focused on is it's not about what I find fun. It's not about what I find interesting, but helping, my kids figure out what they're excited about, because how wonderful is that if you can help nurture something that they become passionate about. And, and again, I think it's just validating their feelings and it's an interesting process. And then if you get to see it start to finish, my youngest daughter is, she's in a period of life where she's starting to experience some really cool things in life. And, she, in her career, and she started when she was like 9 years old, or as far back as I can certainly remember, that she was super passionate about this specific activity. And now at 29, she's starting to appreciate that success from that. And you think about that, somebody who was really focused on something at 9 years of age and now starting to achieve success at 29, and 2 decades of work. It's amazing. And that's helped me also come back to what they're passionate about doesn't need to be what I'm passionate about. But it's amazing to watch the success, that she specifically achieved because of, that persistent and getting the support she needed, along the way. My wife is an amazing support system for all of our kids, and just supporting them each on their path. I think that's really the key. I mean, she's really taught me a lot in that regard, and I think that's what's critical. It's really special to see somebody be really successful and excel in a particular area, and it's really about finding what they're passionate about.
That's so great. All right, last question for you before we get you out of here. I always like to end on an encouragement each week, and what I know about our audience is there are a lot of people who have no clue what the heck they're doing on this journey. They have a kid who just happens to love this sport, and they're trying to encourage and support their kid in the best way possible. For that parent this week who may not know what they're doing, how would you encourage them to go through this process as they do it?
Wow. Yeah. I think it's a little bit of what we've been just focused on the last, 5 minutes or so, which is, I think, validating their feelings and supporting them, and on their journey. I think that's really it. Somebody that, just that they know that's always there for them. You don't have to know the answer, that's the important thing. I don't know that any of us know the answer, but, to just really know that they have a place that someone's there for them, that validates their feelings, and then really, is supportive of them along the way. I think that's the sort of key essential ingredient. We can't create or instill passion. We can't create or instill work ethic, but we can be incredibly supportive of them, give them a safe place to validate their feelings and support them along whatever journey they take. So that's really I think the take-home message for me. Absolutely. Thanks, Jonathan. I really appreciate the opportunity to chat.
Thank you, sir. That's it for today's episode. As a reminder, if you want your weekend playbook, head to healthysportsparents.com/playbook or click down in the show notes for the link. The merch store is open as well. That link is in the show notes. Every shirt you buy is one step closer to the Healthy Sports Parents book getting published. If you like the show today, I'm going to invite you to subscribe on your favorite podcast app or on YouTube. If you're listening on Apple Podcasts, it'd be a huge help for you to write up a small review. If you're on YouTube, make sure to hit that like button as well. If this episode has helped you in any way, the best thing you can do to help us grow the channel is sharing this episode with a friend. Most of all, I hope you enjoy your time with your kids this week, watching them play the sport they love. Have a great week, everybody. We'll talk again soon.